back in my role when I was an epidemiologist, like my role was to gather prevalence rates for end-stage renal disease and kind of calculate what we thought that was going to look like in a 1, 3, 5, 10-year span, right? And so I would go into clinics and I would have to educate them on, because like if my job was I'm talking to cardiologists this month and I need to know all of their all their hypertension patients with a blood pressure result at their last reading of 140 or higher, right, on their systolic. And so I would go and I would try to gather this data. And they'd be like, they can't share it. And I was like, I literally need to know the number. You have 38 patients with a hypertension of this number. I don't need to know any other data. I need to know a number. And I need to know age ranges, like, 20 to 30, 40 to 50. And it's all completely within HIPAA, right? But because also like they're afraid of HIPAA, number one, to share even that very innocuous kind of benign information that I'm asking for, they're afraid to share that information. But then also the EMRs do not make it easy to pull that type of information from, right? Because EMRs have, like in healthcare, we haven't had that interoperability requirement that's in literally every other sector, which we're trying to get there. We have the Cures Act now trying, CMS has pushed out some new regulations around that. But until we have true interoperability where like Chuck's devices can talk to the EMR and exchange data and it's EMR agnostic. Yeah, in real time, like that type of big data will not be used. So I'm here to tell you, it is not against HIPAA to share information, so long as you're sharing it within the guidelines of HIPAA. And sharing de-identified information is 100% permitted. And it is important not just to get better tools out there for the healthcare industry to be able to treat your patients, right? So like tools like what Chuck is developing and like the clients that Francesco is working for, they're on the cutting edge of technology and cannot seem to get the data that they need in order to push forward because healthcare doesn't want to share that information. It is allowed, right? So healthcare is harming itself by not allowing that information to be free flowing because like Chuck said, that data is the lifeblood, not just to the patient's better quality of life, but also to the business perspective of the healthcare industry as a whole.